assonance. Which of the following diagnostic tests is most appropriate to determine the source of this patient's elevated testosterone? Okay, and then we have, looks like different imaging. Okay, so a 45-year-old woman presents to the clinic with complaints of increased facial hair growth, deepening of her voice, and irregular menstrual periods over the past 6 months. On physical examination, she has hirsutism, male pattern baldness, and clitoromegaly. Her lab findings reveal elevated serum testosterone levels. So which of the following is most appropriate to determine the source of the patient's elevated testosterone? Okay, so facial growth, deepening of voice. So thinking virilization. She has irregular menstrual periods. Male pattern baldness. Okay. High testosterone. So
What's your diagnosis?
I'm thinking maybe something like a Sertoli-Leydig mass,
Okay, that's one thing. Yeah, it could be.
because that will increase testosterone. Um,
What else could it be, you think? So what in what diagnoses which can give you hirsutism that you know in female.
PCOS, but
Okay.
PCOS doesn't, I think one of the questions I've gotten wrong before is that it doesn't have clitoromegaly
Okay.
or deepening of the voice, but I know it definitely has that hirsutism.
Okay. So that's a possibility. So I'm thinking, maybe those two. Okay. So then how do you want to evaluate, how do you want to figure out the source?
So if it is some kind of mass that is producing this testosterone, um, let me see so probably not, oh wait, so probably not abdominal ultrasound.
Okay.
Um, I don't know about adrenal vein sampling, just because I haven't really seen that before.
Okay.
I don't think CT scan of the chest, just because it's nothing like pulmonary or anything like cardio. So now we're down to pelvic ultrasound or MRI of the brain. So when I think MRI of the brain, I'm thinking anything that's related to like the HPO kind of axis, which would be more along the lines of like prolactinoma and things like that.
Okay.
So I would probably say pelvic ultrasound.
Good. So what I'm thinking here, right? I mean, PCOS or androgen secreting ovary tumor. So the best way, right, to figure that out is an ultrasound of the pelvis, right? Because you want to look at the ovaries, right? Because in this woman, right, you're thinking, okay, maybe it's sertoli tumor, right? So then it's going to be an ovarian tumor. So you want to take a look at that. Abdominal ultrasound, right? Is not as good, right, as the pelvic ultrasound. It's more of kind of gut, right? MRI of the brain, like you said, right? Hyperprolactinoma, Cushing's disease, but not kind of adrenal. I mean, not adrenal. What is it called? Uh, Testosterone secreting tumors, right? CT of the chest, right? This is not going to help, right? Adrenal vein sampling is super invasive, right? But usually for bilateral adrenal hyperplasia versus unilateral, you don't really need this. So pelvic ultrasound is going to be your best answer here. So good. So you can evaluate for both PCOS versus right adrenal secreting ovarian mass. So good.